somatosensory system is the complex network of neural microstructures in the brain sensory pathways from the skin, which gives information on pain, temperature, and touch, are mapped onto the somatosensory cortex located in the partial lobe. It is a part of a larger group of related sensory nervous system, which also represents visual, auditory, olfactory, and gustatory stimuli. These senses input and output. The discoverer of the somatosensory system, which was named for homunculus discoverer Wilder Penfield, American-Canadian, born January 26, 1891, neurosurgeon, in which Wilder, the brilliant neurosurgeon that expanded the methods in the brain surgeries and techniques, which include mapping the factions of various regions of the brain, such as the cortical homunculus, and lived to the age of 85, passing away on April 5th, 1976, dying from abdominal cancer in 1940. A video of a living decapitated head was recorded by a Russian scientist, which was filed in the Prelinger archives. The operations in which are credited to Dr. Sergei Bryakonenko and Boris Lavanskosky, who were demonstrating a special heart-lung apparatus called the autoejector, also referred to the heart-lung machine, to the Second Congress of Russian Pathologists in Moscow. It was filmed at the Institute of Experimental Psychology and Therapy, which is also in Moscow. The heart-lung machine was designed and constructed by Bryakonenko, whose work in the film is said to have led to the first operations on heart valves. The auto-ejector device demonstrated in the film is similar to modern ECMO machines, as well as the system commonly used for renal dialysis in modern nephrology.
And the sound.
Pupils dilating, or in other words called mydriasis, is where the pupils of the eyes dilate, in which usually caused by the sympathetic nervous system and cause an influx of light intake into one's pupils. Also sympathetic nervous system, in which are triggered by the body's rapid subconscious response to dangerous stressful situations, and also the mydriasis can also be triggered by emotions such as fear, interest, excitement, and love, in which can increase responsiveness. Once triggering the mydriasis effect, this can, and most of the times through the brain, release chemicals such as dopamine, oxytocin, and serotonin, in which are called the happy hormones. And why is this called the happy hormones? Well, for instance, dopamine is the cause of feelings such as well-being, the primary driver of the brain's reward system. It spikes when we experience something pleasurable, in which dopamine is a type of monoamine neurotransmitter. Neurotransmitters are a chemical messenger in which your body can't function without. Now, there are 7 small molecule neurotransmitters, such as acetylcholine, dopamine, gamma aminobutyric acid, glutamate and histamine, norepinephrine, and also serotonin. But the main neurotransmitter that I am to talk about is dopamine, oxytocin, and serotonin. Now, dopamine is most particular, especially involved in helping us feel pleasure as part of the brain's reward system, sex and sexual desires, shopping for exciting things, smelling desirable foods, and meeting with an old friends or beautiful woman or man, pleasing one's senses. All these desires, emotions can trigger dopamine release or a dopamine rush. Now, what is oxytocin? It is a peptide hormone and neuropeptide normally produced in the hypothalamus and released by the posterior pituitary. It plays a role in social bonding. Well, the oxytocin is typically linked to warm, fuzzy feeling and shown in some research to lower stress and anxiety. Oxytocin has the power to regulate our emotional responses and pro-social behaviors, including trust, empathy, gazing positive memories, processing of bonding, and positive communication. Oxytocin is also responsible for promoting positive feelings. Sorry ladies if I'm skipping the part about the importance of oxytocin and the part it plays in giving childbirth. I'm just really not that interested. Now, what is serotonin? It is a chemical nerve cell produce. It sends signals between your nerve cells. Serotonin is found mostly in the digestive system. Out through, it's also in blood platelets and throughout the central nervous system. Serotonin is made from the essential amino acid tryptophan. Serotonin is a crucial chemical for increasing mood and decreasing anxiety. Researchers have found a clear connection between low serotonin levels and increasing in depression, anxiety, and other mental health challenges. Besides being helpful for mental health, serotonin also improves digestion, sleep, and bone health. What does serotonin do? Serotonin impacts every part of your body, from your emotions to your motor skills. Serotonin is considered a natural mood stabilizer. It's the chemical that helps with sleep, eating, and digestion. Serotonin also helps reduce depression, regulate anxiety, heal wounds, stimulate nausea, maintain bone health. Serotonin sends signals between your nerve cells. Serotonin is also in blood platelets that throughout the central nervous system. Serotonin is made from the essential amino acid tryptophan. This amino acid must enter your body through the diet and is commonly found in foods such as nuts, cheese, and red meat. Tryptophan deficiencies can lead to low serotonin levels. This can result in mood disorders such as anxiety and depression. Generally, the normal range of serotonin levels in your body is 101 to 283 nanograms per millimeter. The benchmark, however, may differ slightly depending on the measurements and samples tested. Researchers have found a clear links between low serotonin levels and increase in depression, anxiety, and other mental health challenges. Besides being helpful for mental health, serotonin also improves digestion, sleep, and bone health. High serotonin levels can cause shivering, heavy sweating, confusion, restlessness, headaches, high blood pressure, hypertension, muscle twitching, diarrhea, and more. Serotonin is a hormone that helps stabilize moods, regulate feelings, regulate anxiety, and control sleep. Serotonin is also a neurotransmitter that well-being and happiness, regulate anxiety, and control sleep. Serotonin is another neurotransmitter that is medicated satisfaction, happiness, and optimism. Serotonin levels are reduced in depression, and most modern antidepressant drugs known as serotonin reuptake inhibitors SSRIs act by increasing the amount of serotonin available to the brain cells. Serotonin helps regulate the body's internal clock, including the ability to feel sleepy, remain asleep, enter rapid eye movement, sleep, and wake in the morning. People with chronic insomnia, usually sleep patterns, chronic fatigue, or consistently vivid dreams may have serotonin deficiency. The serotonin test measures the level of serotonin in the blood. Depending on the specific test, serotonin affects every part of your body. It's responsible for many of the important functions that get us through the day. If your levels aren't in balance, it can affect your mental health, physical health, and emotional well-being. Sometimes a serotonin imbalance can mean something more serious.